get confirmation. I'm not sure exactly what the attachment will include, but you'll get some kind of a record of your attendance that will be emailed to you next week. Okay. So yeah, just to clarify, the closed captioning is located just below the chat box within the media viewer. Okay, so if you see that down at the bottom right-hand side, you see media viewer. There's a little tiny arrow right next to media viewer. You click on that arrow, that'll open and close the closed captioning. Okay, so that's all from me, and I'm going to go ahead and turn this over to Susan Blumenfeld. And again, we really appreciate you all for joining us. Thank you so much.
Hi, Jen. Am I unmuted right now? Let's see.
Yes, you're on, Susan.
Okay, great. I wasn't sure. Welcome, everybody. It's so exciting to have you join us today from all across the country. I've been looking in the chat box, and we wanted to welcome you to the first of a series on working with children, youth, and parents impacted by domestic violence. Thanks to Rachel for walking us through the technical aspects of this, and many, many thanks to my colleagues Jen and Erin for helping us and guiding us through this process today. As Rachel said, this really is a group effort. All right, so I'm going to get started, and hopefully I will know what I'm doing here. I'm trying to advance the slides. Let's see, maybe oh, good. All right. Hopefully all of you are seeing the slides advancing. The first one is of our center. If you haven't already visited us at our website, I would encourage you to do so. We have lots of great resources, and we're also here for you in terms of providing TA and resources that you might need to help you in your work. Okay, so the work that this webinar series grew out of really started on the ground in Chicago doing capacity building work with community-based providers, and we've been doing this for over 10 years. And our initiative began with funding from a private philanthropic foundation, the Irving Harris Foundation, located in Chicago. And we're very grateful to them. They continue to sustain us in this work, and it's informed a whole evolving process for us. And we've been able to take that and then work with state coalitions across the country and member programs. And that process has enriched and informed our work as well. The approach that we've used is to combine foundational training with extended in-person or telephone consultation to build trauma-informed family-centered services. And we work primarily with domestic violence advocates, program supervisors, mental health clinicians, and recently we're looking at bringing some of these resources to child welfare professionals, working with families where domestic violence occurs and children are also being abused or neglected. We're excited to be bringing this work, however, to a broader audience through this webinar series. And our hope is to be able to enrich these online experiences by providing you with additional resources and conversation guides that we envision you might walk through yourself and or gather at lunchtime or at other places within your agencies and programs to talk together about some of these issues. We want to be responsive to your feedback and interests, and we want to make this as interactive as we can, even though we know it's a very different venue than training face-to-face. As Rachel mentioned, this is a 10-part webinar series that I'm going to be hosting that draws on a domestic violence curriculum that was developed in partnership with our center and written by Patricia Van Horn. Patricia was a cherished colleague and mentor who died this past January, and we're dedicating this series in her memory. In addition to drawing on the curriculum, we're also going to have these other materials for you to help support your work, because we know from doing this work in Chicago and around the country that you not only want information and want to share your own perceptions, but also want things that are going to be practical and useful for you in your day-to-day work. So the next two slides are just going to give you an overview of what we're covering in the series. We will have announcements coming out that are going to give you more detailed information on them. And the second one, which is coming up next, which some of you are already signed up for, is going to be looking at, and we want to start with, after this foundational webinar, we really want to start with examining the impact on us of doing this work and how working with children in particular may affect us. So we're going to talk about managing our own stress, sense of isolation, what we can do to foster resilience for ourselves and within our organizations. So looking forward to many of you joining us for that. And the second slide just shows you the remaining series. So in any training that we do, we really want to allow for people to have space to reflect, to think about what we're talking about and what you're taking in, and to also be self-aware and mindful of your own self-care. We know that trauma has an impact in our lives personally and in the work that we do. And sometimes as we start to talk about this work, there may be memories that you have and or graphic details that might come up that will evoke memories in you or other feelings. And so we want you to be able to take a break, step away, doodle, color, get some coffee, have a healthy snack, whatever it is that you want to do. And as Rachel mentioned, we are recording all of these webinars, so they'll be archived. You can always come back to them and you won't miss anything. So today's webinar is in 3 parts, and after each part we're going to pause, take a little break, maybe stretch, and then Jen will help field some questions that you might have, or comments or reflections. So we're going to leave some time to do that as well. I want to begin by talking about what I think are really key themes that we're going to be looking at today and that are going to get expanded throughout the webinar series. So we're going to think together about what it means for children to experience domestic violence in their caregiving environments as they grow and develop, and what determines impact and the traumatic effects and how that can vary greatly. We're looking at things also not only from a trauma-related perspective, but from a developmentally sensitive perspective as well, because we know that age and the child's developmental capacities make a difference in terms of how they're experiencing trauma and how they react to it and respond. And then another really critical point that all of the resilience literature is telling us is that non-abusive parents and caring adults are really the single greatest resource that children can have to promote their resilience and healing from the traumatic effects. And as the webinar series unfold, we're going to really look more specifically. We'll talk a little bit about that today, but we're going to look more specifically about how we can support non-abusive parents to support their children. So in this first part, a lot of what we know comes to us through doing the work, through hearing the stories that survivors tell us, from listening to children and what they tell us about their experiences. And also we now have about 25 years of research, and we can draw on that as well. And then there's some national surveys that we can talk about that are broader surveys that look at children's exposure to violence. And I'm assuming that many of you on the call are probably already familiar with this, so we'll talk about that. So let's begin by thinking about prevalence of domestic violence, exposure to domestic violence. Again, this was from some larger scale studies that were done. And really, when you think about it, it's a pretty staggering number in terms of the first figure up there. And that comes out to be about just under 1 in 3 children in the United States experienced at least one incident of violence in their homes in the last year. And a smaller number, maybe about 13% of all children in the United States experience and are living with ongoing and severe intimate partner violence. And it's that latter group that's really can be more at risk for developing trauma-related responses and mental health challenges without help and intervention. So this may be really unnecessary for many, many of you on the call, but I feel called upon to say that we know that many children experience loud arguing, yelling, shows of aggression between their parents or parent and partner, and there may be broken dishes from now and then. But I want to pause to say that sometimes this gets misunderstood by helping professionals, not so much helping professionals in the DV community, but helping professionals and the general public. And where people say, well, isn't that domestic violence? And in fact, we know that if, in fact, this kind of arguing or fighting is taking place and the power is fairly equally shared between the adult partners, then it's not domestic violence. So here's the standard definition. And we know that domestic violence is an ongoing pattern of behaviors used by an intimate partner or spouse to control the other partner. And it may include physical and sexual violence. It also can include verbal and emotional abuse, and also threats and coercion and intimidation and isolation and economic abuse. And when we're capturing information through large surveys, we don't always get this contextual piece where the non-abusive partner may be so frightened and intimidated from prior threats that just a look is enough for everyone in the family to feel terrified. So I want to make that point too, because I think that's really important for us to take in and think about in terms of children's experiences and what the non-abusive partner experiences. If you're not familiar with the power and control wheels that the Duluth model has used, we can get you that information. But I think it's a good place to start. I like to refer folks that are not doing the domestic violence work on a day-to-day basis to that as a resource. So I'd like you to take a moment now and bring to mind, if this is helpful to you, several of the children or families that you're working with now. When we start to talk about children and their experiences, it's so important for us not to make overgeneralizations about children's experiences. And I want us to be really careful about that and to think about them as individual, varied, and unique. We also know anecdotally, and from some of the research that's been done, when we hear children's accounts or DV survivors talk with us, or when adults look back retrospectively at their growing up years, if they've experienced DV, that in general, although the experiences are varied and unique, children and survivors report that they're growing up in a caregiving environment that's characterized by tension and fear. Children often think that they are at fault, that I could do something to stop this, I'm the one. And they're trying to figure out why it's happening, when it's going to happen next, so that they can try to predict the unpredictable. And often children's lives are characterized by worry for themselves, for the safety of the non-abusive parent. And they may worry about their siblings. And depending on the level and kind of violence that they're experiencing, they may also be worried about the safety of their pets in their house. Often we hear from children that, and adults when they look back, that the family violence was kept secret from the outside, from others. There's a lot of shame that's still connected with this, that children seem to absorb and that the victimized parent seems to absorb. And we know that we all develop ways of coping and adapting to whatever situation we're in so that we can survive. So I want to go through this fairly quickly, but I think it's important just to think about the different ways in which children's exposure to domestic violence may occur. So sometimes it can be more frightening to hear things when you're in your room, either by yourself or with a sibling, that you can't see, and you can imagine the worst, or you imagine things from what had happened in the past. And then we know that sometimes children see the aftermath, so they see injuries that their parent has, or the parent's own kind of trauma reactions or responses. Furniture is broken, household items, dishes are broken. There's police intervention sometimes, there's arrest. Sometimes the non-abusive parent ends up getting arrested because of accusations made by the abusive partner. And sometimes kids are taken into child protective custody. All of those things can happen and are frightening. We also know that in the midst of a pattern of domestic violence, that sometimes children directly experience harm. They may experience verbal abuse. They may inadvertently get harmed as a result of the violence that's going on, or it may be intentional on the part of the abusive partner. Or it may be that the child, as children get older, step in to try to protect the non-abusive parent and get hurt. It can also involve being locked out of the house when it's cold out, being deprived of food and other basic needs. We're finding from the recent research that's out there that despite survivors' best efforts to protect children from seeing or hearing what's going on, had many survivors tell me, I tried to take it into the bedroom so that they wouldn't see. There are many ways that they're trying to shield and protect their children from it. But unfortunately, the vast majority of children do witness what's going on. And young children, because I'm assuming they're home more, witness more. They're at greater risk for witnessing DV. So I think with many of the families that we come in contact with who are seeking services, we're really seeing the severity of the violence is more in that second or third part of the triangle. And So we're really working with families where there's more proximity, severity, and prolonged or ongoing exposure to domestic violence. And we know then that that's going to have a greater impact, and children are more likely to experience trauma-related responses. And a lot of their energy is going to go into surviving, being safe, trying to be safe. I think the other piece that is really important for us to take in and think about is the ways in which that it's not only the witnessing and experiencing of what's happening to the non-abusive parent, but also that children are used by the abusive partner, and they're used as a means of controlling the non-abusive parent. We know that the authority of the non-abusive parent is undermined all the time, and that her or his ability to care for the children is impacted. Often there are threats or actual harm done, or children are abducted as a means of controlling the non-abusive parent. So threats such as, you'll never see your child or children again if you leave me. First time I have visitation, you'll never see them again. And then we also know that non-abusive parents really face the humiliation and pain of seeing their children forced to witness and sometimes even participate in the abuse. And often the threats and intimidation are they're going to call or they threaten to call the authorities on the non-abusive partner, the police, child welfare, or depending on immigration status, immigration. And then we know that post-separation, the abusive partner uses child visitation and contact to further harass, monitor, try to control the non-abusive parent. And we're also familiar with how often survivors tell us that they're engaged in these long, drawn-out custody battles that really seem to be another way or means of trying to punish and control the non-abusive parent. So one of the larger surveys that's a huge representative survey that's through the Department of Justice is the National Survey of Children's Exposure to Violence, which I mentioned earlier. And we know from that study, and there are bulletins that are coming out on that all the time, and we do have a reference to it at the end in our online resources. But DV may occur at the same time as other stressful and traumatic experiences in children's lives. And what they found from one of the studies, the second kind of report, was that children that are exposed to multiple types of violence are at higher risk for lasting effects and harm, compared to those children who may experience repeated exposures to a single type of violence. So the takeaway here is really that exposure to multiple types of violence, crime, abuse lead to worse outcomes for children without intervention, without services. And there's also a cumulative effect that we've seen in the work and in the consultations that we've done, which is that one kind of exposure to violence ends up becoming a reminder for other past or current types of violence that are going on, and they evoke feelings in children of loss of safety and protection. And there is a cumulative effect around that that makes children feel more vulnerable, understandably. So along those lines, estimates vary in terms of children who are experiencing DV who are also at greater risk for being physically or sexually abused in their homes. again, on the first bullet, in terms of physical abuse, we know that there, again, from research studies, there's a correlation between the severity of violence towards the non-abusive partner and child abuse. And this is not only devastating for survivors, but it's difficult for us as professionals as well. There are many complex issues related to children's safety from harm. And we know from survivors that the risk of escalating harm to their children may become, against a lot of odds, the primary reason for them to leave their partner. On the other hand, we've also heard from mothers that they may stay because they don't want to risk unsupervised contact with the abusive partner and parent who has legal rights to shared custody and visitation. So these are very complicated, complex issues. And we know from best practice that children's safety, when we can improve children's safety when we can help the non-abusive partner become safe, and we can support those efforts. And at the same time, hold the abusive partner who's parenting to the same standards for nurturance, care, and safe and responsible parenting. Okay, we're going to pause here. People may want to take a break, a little break, get up, stretch, and I will see if folks have some questions that we might respond to. So I will wait for, while you all are stretching a little bit, I'm going to wait for my colleague Jen to present me with some questions that you may have or comments. Jen?
Hey, Susan. Just one question came up around
Sure.
slide 18, where you were talking about the exposure to multiple types of violence as opposed to the same type of violence and the difference between the two.
Okay, can everyone hear us, Jen? Or?
Yep.
Okay, great. So talking about what kinds of violence, thank you. Let me clarify that. So we're talking about exposure to community violence. We're talking about physical abuse. We're talking about sexual abuse. We're talking about traumatic experiences that may be accidents, natural disasters, so a range of both interpersonal and other kinds of traumatic experiences. And this makes me think about something that a little 6-year-old girl said she was staying in a shelter, DV shelter with her family, and when she was asked by the children's advocate what was really the scariest thing for her in terms of her experiences. And the advocate was all prepared to hear something about the event or the episode that had brought them to shelter. And what she heard instead was that this little girl was remembering a very, very frightening incident with her older brother and a friend of his on the playground near their neighborhood, in their neighborhood, where a knife had been involved, and she was afraid for her brother's life. So again, I think that highlights that we need to ask those kinds of questions and understand what's scary for children, but that sometimes it can be community violence. It can be something that, as we know, all too often seems to be happening in our schools for children, and or it can be accidents, or it could be a fire. So I hope that answers the question. Okay, so Jen, if that is the only question, then I'm going to go on to the second part. So we're going to talk some about really looking at a framework that we'll be talking about in more depth during the webinar series. But we know that children can experience both the immediate and longer-term effects from experiencing domestic violence, and as we know, they may also have other traumatic experiences in their lives. So I think it's really helpful in those situations, again, depending on how old the child is, but to ask the parent, you know, are you seeing some changes from how your child was before, and in what ways? And so sometimes parents will tell us that their child isn't sleeping well, or their eating has changed, or they have physical complaints. They're getting lots of headaches or stomach aches, or they're having trouble concentrating in school. So when we want to think overall about how our caregiving environments can affect us, we start with looking at how we are shaped by our earliest relationships with parents and other caregivers, and all of this in the context of our homes, our culture, our families, our community, and society. And I want to also emphasize, even though this webinar is not looking specifically at this, the importance of culture and understanding beliefs and practices related to child rearing, how domestic violence, for instance, is talked about or recognized or not identified within a particular culture. I know from some of the families and advocates that I'm consulting with that in some of the immigrant families that we work with in the Chicago area, they don't have a word for domestic violence in their culture. And so it's really bringing that understanding and appreciation to the work that we do. And so I think the takeaway here is that our earliest relationships really provide a model for how we see ourselves, how we see others, and how we see the world around us. And they're a model for our relationships as we move on in our lives. So we know from lots of child development research and that by 1 year or a year and a half of age, we know whether or not children are securely attached. And usually that secure attachment is there throughout the child's life with a caregiver. And once it's established, it might get disrupted, but it can be repaired. And those children that are securely attached to at least one loving, nurturing caregiver have better outcomes in their lives. So exposure to DV is really a kind of traumatic stressor that compromises the child's source of safety and protection. We're all hardwired at birth to be protected and to be safe, and that can get breached when we're growing up in a violent environment. And children then may have to invest energy in maintaining their own survival and self-protection. And as we saw in the slide before, it may be hard to go out and explore if you're too worried and preoccupied to explore your world and learn because you're anxious. And you may not have a consistent safe haven to come back to when you're upset, scared, or overwhelmed because the parent that you might rely on is under siege herself or himself. So we're talking about traumatic stressors, and I just wanted to take a moment to define trauma. We like this definition through our center. That was developed by Kay Sock-Whitney and Laurie Perlman in their work a number of years ago. But I think the key piece here is that we get overwhelmed and we can't integrate our emotional experience when we're experiencing something that's traumatic, and we experience a threat to ourselves, to our bodies, or to emotionally. And that can either be objective or what we're feeling. So when we're talking about children, there is a really important addition to the definition. That is threat not only to themselves but to a parent or primary caregiver. And I think this becomes particularly significant when we're thinking about children in the context of domestic violence. We know the younger the child, the more dependent they're going to be on a parent for care and support. Okay, so what determines impact, and what accounts, if you've got those kids in your mind that you were thinking about, that you may be working with, some are probably faring better than others. So what accounts for differences? Okay, so we do know from our study, so we're really talking about this interplay of a lot of different important factors, but we know that many children do well as they develop and grow into adulthood, and they may not need additional supports or interventions. So I want to make a really important point that not every child is going to develop traumatic stress responses to experiencing domestic violence, and we spent some time in the first part really talking about how that exposure and experience can be very different and experienced differently by different children within the same family, right? So the first part, the child's age makes a difference, what their developmental capacities are. A 2-year-old may not understand what's going on in the same way as an older child might. So a 2-year-old might see their parent on the floor and think that they're just sleeping. An older child might realize that there's been a serious injury to a parent. So we also in this first part takes in the individual characteristics of the child, their temperament, also what their health and medical history and developmental history has been like. And also how, again, for so many of the children that we work with, they have experienced domestic violence from a very early age on, sometimes in utero on. But for other children, that may not be the case. So how have they been doing in the past? How are they functioning? What's going on for them? How are they faring? And we can find that out by being curious and asking their parents and other caregivers about how they are as well. And as children are older, obviously we can ask them directly. The second part, and you have probably heard me say this over and over again, with the nature of the event, the proximity, severity, and ongoing and the prolonged exposure to abuse is going to have a bigger impact on most children. The third part about family and social environment, it really looks at and helps. It helps us, I think, when we're thinking about impact, to look at what kind of resources and supports are available within the child's environment. What's the quality of their relationships with parents and other primary caregivers like grandparents or even older siblings? I remember a little girl saying, she was staying in a shelter, saying, "I miss my grandma's flower garden." And she really missed her grandma, who was a tremendous support to her. Her particular family situation, there was a lot of lethality and ongoing abuse that she had been exposed to. And her relationship with her grandmother really was a kind of safe haven for her, and she missed her. Even though she was safe in shelter, she missed that relationship. And we know that given the nature of domestic violence, that the non-abusive caregiving parent is stressed themselves and may be under siege. And so obviously that would impact anybody's ability to be there for their child in the way that they might want to be. Which does not mean that children who experience this do not have secure attachments to the non-abusive parent. That the two, we can hold the two together. So the fourth part really looks at what are the other stressors or adversities. And here we can think about, is a child also being abused at the same time? Are they exposed to community or school violence? Has there been a death in the family? What else is going on that might also be stressful for this family? If in fact the family goes to shelter, or the parent separates from the abusive partner, they may have other challenges in terms of economically, and there may be losses because they're leaving their home neighborhood and leaving friends and things behind, and that's also stressful. And we also know from the research out there that poverty, parental substance abuse, and mental illness also are stressors that contribute and may worsen impact. I do have to say as an aside that I think that with both parental substance abuse and what we might refer to as mental illness, when we're thinking about the non-abusive parent, some of that may be quite linked to the traumatic experiences of being victimized through a domestic violence situation. And for some of the parents that we know and meet who are courageous and strong have also experienced trauma when they were growing up in their lives that may be unresolved for them, and they didn't get services or supports along the way. And so that's also impacting them in the moment. And the other thing that this model comes from a child psychiatrist, Bob Pynus, and his colleagues who did a lot of the pioneering work around child trauma. And the other thing that Pynus talks about is that the trauma that children experience through domestic violence lives on in their bodies and minds, and that there are trauma reminders, and we're going to talk a lot more about this as the series unfolds, but the trauma reminders that might be related to exposure. So they start to re-experience what happened before as if it's happening now. And we know for so many children and families that it's not post-traumatic. It's because the trauma isn't post. It's still ongoing through contact with the abusive partner who's a parent, through custody arrangements, through court battles, through violation of orders of protection. So all of that contributes to impact. And at the same time, thankfully, impact is buffered and may be lessened by all of the protective factors in children's lives, both their innate capacities and what they can draw on from their family and their environment, and including families' cultural and spiritual beliefs and traditions. We know with older kids, having a safe place to go and talk and being connected with other caring adults and people in their lives helps buffer the impact. So in this situation, the child's affected, the parent or caregiver who's threatened, controlled, and hurt is affected, and their relationship may be affected as well. And in that situation, the attachment relationship that we know is so important for children's healthy growth and development can get strained or disrupted and may not be consistently available to the child. So they have one parent or partner that's living in the home who is frightening and controlling of them and of their non-abusive parent, and maybe abusive to them as well. So the next part, so why should we care about children's age or developmental stage at the time of exposure? We think that you need to have both a trauma-informed way of looking at things and a developmentally sensitive lens in order to better understand and respond to the needs of children. So I think it's very helpful to ask ourselves, and there is a webinar coming up where we're going to look at principles of child development around what are the developmental tasks at the time of exposure, and how does traumatic experience interfere with that unfolding process. So, for example, if you think about a toddler who is going out to explore and kind of feeling excited about what he or she can do, and then is experiencing a lot of fear and fright and overwhelmed feelings because of what's happening at home, that child may then regress and start to cling to the non-abusive parent and not want to go out and explore their world. A little later on, we're going to look at how trauma responses may differ when we're thinking about different ages as well. Okay, so this is the same message that's so important that leads to poor outcomes and more traumatic related responses in children. Okay. So the mental health field has just put out within the last year a new diagnostic statistical manual, and they've changed some of how they're talking about post-traumatic stress disorder, PTSD. And we also see in children that they may not have full-blown PTSD, but that they can have some of the symptoms that fall in the categories that are listed here. And I'm going to spend a little bit of time talking about these, but you're also going to have a handout or a resource after the webinar that I think will give you some more detail on this. So in re-experiencing, we're really talking about children and adults for that matter, experiencing visual images or flashbacks related to what they experienced. Not being able to stop talking about it or thinking about it, having nightmares, and having a range of body-based sensations. So they may have heart racing, they may feel anxious, they may experience pain in their bodies. We also see with children that are old enough to have the capacity to play that they may do what we call, it's a particular kind of play called post-traumatic play, where they're repetitively over and over again reenacting a fragment of or a part of what they experienced that was traumatic. And unlike the wonderful ways in which play helps children master their experiences and feel better, post-traumatic play is just like running over the same tracks over and over again, and actually it can lead children to feel more anxious, and there's no relief and there's no mastery in it. Avoidance is both externally avoiding people, places, and things, so that we don't have to be reminded of the trauma. It's kind of hard when it's happening in your home, however. Or avoiding thoughts or feelings that are trauma reminders. Now this next category is a new one with the DSM-5, but it really kind of re-sifts or resorts things that were part of PTSD before. So it's called negative alterations in cognitions and mood. And that really refers to how we view ourselves or others, feeling isolated, having thoughts about I'm a bad person, and also really having very constricted mood and feelings. And we see kids who might have joyfully jumped rope or enjoyed playing with things that have really diminished interest in the activities that they previously liked, or they're avoiding them. This particular category also looks at memory difficulties. And the last one, alterations in arousal and reactivity, we used to call hyperarousal. And it really has to do with flight and fight responses. So here's where you're going to see children who are hypervigilant. And one of the examples that I love to give is one of the first days I walked into a shelter that I was doing some consulting for. I walked in, I was wearing one of my favorite sweaters that was a sherbet orange sweater, and I walked through the main room and I saw kids very absorbed in their work. They were playing and they were doing some artwork or something. And one of the little girls, right after I left the room, immediately ran up to the children's advocate and said, "Who is that lady in the orange sweater?" So I didn't even think she had noticed me. She had not only noticed me. So kids get hyper vigilant because they're on high alert because of the scary experiences that they have had. And even when physically they're safe, they're still feeling scared. Hyperarousal also comes up with, you see more aggressive behavior in young children, older children, irritable mood. With toddlers and preschoolers, you may see more intractable type tantrums. So that gives you an idea of what those symptoms are. So again, we know younger children from the literature, and it also kind of makes sense, are going to be more at risk, again, depending on what the nature of the DV and traumatic experiences are, for developing post-traumatic stress responses. They are more dependent on their adult caregivers to help them regulate their feelings that are going on as well. And the PTSD preschool subtype was just added and really has to do with a lot of the work that's been done by Charlie Zena and Michael Schringa in Louisiana, where they have worked with children and families that have experienced trauma of all kinds. I think it's important to note that with young children, from birth through age 3, you might see some different things like new generalized fears. So the trauma that they're experiencing may be happening in the home and have nothing to do with dogs, but suddenly the child is afraid of dogs, all dogs, and is afraid to walk through the park or is afraid to get into the bath, and it was not related to something abusive that happened in the bath at all. We also see that children may lose their recent developmental achievements or milestones. So if they were walking or talking, they may regress more. And I think this is very, very scary and disheartening for parents. And when we talk about the fact that they will regain these accomplishments and achievements and their developmental momentum will be resumed once they're feeling safe and secure again. I think that's really important to keep in mind. Okay. So often, children's behavior gets misunderstood and not seen within the context of traumatic experiences. We have parents and others saying, here, she's just a bad kid, or they're acting like a brat, or they're being a baby, or, or we have parents talk about the fact that they're afraid of their 6-year-old or 7-year-old because they remind them so much of the abusive partner. So I think that it's really important for us to try to think about what might be going on for children. And one of the examples that I like to give is that if a child has recently experienced something scary at home within a pattern of domestic violence, and they've got a big test at school the next day. Let's picture a 10-year-old sitting at a desk about to take a math test, and they start to feel anxious because they're taking the test, and that anxiety becomes a reminder for what just happened when they felt anxious at home. And so they can get completely flooded and really unable. So it goes beyond like test anxiety that a lot of children have, because it gets tied in with what's happening at home. And sometimes we don't see that or understand that. Another example that I'd like to give is of a 5-year-old who was staying in shelter with her family, and they were playing hide and seek. And it was her turn to close her eyes and count to 20. And the next time her mother looked over, she saw that her daughter was laying on the ground and shaking. And when she went to her and asked her what was going on, what had happened was that her daughter was, and she was able to tell her that she was re-experiencing, she was having an intrusive flashback of a time that had been very scary in their family when her mother had been assaulted. And so it's helpful to really understand what might be getting stimulated for children that's not happening in the present, but that they're re-experiencing in the present, and that might lead to behavior that if we didn't have a trauma understanding doesn't make a whole lot of sense to us. And then I also want to say that sometimes, and particularly with younger children before they have language, and even if they do, we don't always know what it is that is a traumatic reminder for them. But if we keep this sort of understanding and frame in our minds, then we can continue to be curious and to try to understand what's going on. So another example, kids too often, whether or not they've experienced domestic violence or other trauma in their lives, I think in our society get labeled as having attention deficit hyperactivity disorder. They can't sit still, they're not concentrating in school. Before I get on a soapbox about how our educational system is set up, I just want to say that kids get labeled that way. But sometimes if we don't have a trauma understanding or frame in our mind, we may misinterpret that. Kids end up getting these diagnoses that, and we're missing the traumatic experience underneath that. So it may be a child who is experiencing hyperarousal and can't concentrate because he's worried about his mom and wants to make sure that she's okay and feels like he's got to be home and he can't be in school. Okay, in the interest of time, I am going to refer you to a tip sheet that we will have for you to download at the end that really talks about ways in which we can, as advocates and clinicians, help support parents to support their children and understand what's going on. And I'm going to take one moment here to also talk about okay, I just got a note. Okay. All right, I got a few other questions, so I'm gonna try to leave some time for these as well. Okay. Thank you, Erin. Erin just came in. So what are the potential longer-term effects on a child's development? And I think, again, when we say that we're worried that the more severe and prolonged and early on kids have exposure to trauma, these are some of the things that we might see. So the world is a scary place. They are holding a belief and an expectation that bad things are going to happen to me and other people. We're going to talk a lot in another part of this series about brain development and our stress response system and how these get altered so that even minor stressors end up flooding our bodies if we've experienced a lot of trauma early on. We may experience hyperarousal. We may get angry easier. We may, younger children may have tantrums. Trust in our relationships is affected because that sense of safety and protection got breached. The top one here is huge for children who have experienced severe and ongoing trauma in their lives, and we're talking now specifically about domestic violence, but who really have difficulty regulating feelings and responses and their thoughts and behavior. And then also issues with self-esteem. And so as we talk about how we can foster resilience, you're going to see that these long-term effects are really amenable to intervention and change and support. Okay, so now I'm going to take a look at, okay, so we have 3 excellent questions here. If you all want to stretch a little bit while I'm talking, that would be great, and I'm going to take a sip of water. The first question is, can you speak briefly to the impact of parental deportation of the abusive parent on a child? That's an excellent question. And of course, I think that depends, because we know that part of the way in which abusive partners manipulate their children is by telling them things such as, you know, we'd be together if it wasn't for your mother and what she did, and she's to blame. So I think that children have mixed loyalties to their parents, even when there's abuse that goes on, even when scary things happen. So children, in answer to that question, can both be fearful of and also miss a parent that has been deported. So it's an excellent question, and I think something that we might be able to examine more closely in future webinars as the series goes on. Second question, have there been studies that indicate a difference in children's responses in whether or not the non-abusive parent is the father or the mother? It's a really excellent question, and I am not aware of any studies, but I think it's an intriguing question. We know that the majority of research studies that are done are on heterosexual intimate partners, and I'm really not sure. We also know that in the majority of those situations from the demographics that we have, that upwards of 90% of the abusive partners are male, and there are many reasons, I think, for that in terms of gender violence and our societal beliefs and the role of women. So I'm intrigued by that question, however. We'll see if we can research that. Okay, the third question is, will you discuss ways to work with the non-offending parents who feel guilt and or shame around what they hold themselves responsible for their children experiencing? That is an absolute key question and issue that we are going to be looking at much more closely in the unfolding series, because invariably the victimized parent ends up internalizing in one way or the other all the harsh criticisms and the things that were said about them, and their capacity to parent and their belief in themselves gets challenged. So as we're going to talk, and I'm going to actually move to the next section here, and maybe some of that we'll touch on today, but we're definitely going to be talking about in future webinars. Okay, so here's our definition of resilience. The work that Ann Maston has done, I think, is particularly helpful and important, because we used to think that it was only special kids that were invulnerable to trauma and to terrible things. And now we know that it's not, that you don't have to, it's not something that's an innate quality that you have. It's not, you know, we used to talk about invincible children, that we all have the capacity to be resilient. So you're going to see, and I'm going to run through this very quickly, but when we looked at the impact, this is almost like the flip side of what we looked at in terms of thinking about traumatic impact on children. So what protects children is the flip side of some of those. So we're looking at risks and protective factors. The term sense of self-agency, which gets used a lot, which is kind of a funny term, really means I can get my needs met, what I do and who I am matters, I can be effective in the world. You know, you do see some kids that are going to come up to you and ask for things, and other kids through their experiences who don't seek out help from adults because they're not sure that adults are going to be able to help them. Okay, so we talked also about what's available to the child and to the family and what kinds of social supports and systems that are there that are responsive to the needs of families, because we know that there are many needs beyond our emotional well-being that families face. But the single most important protective factor for children is a loving relationship with a parent or other adult invested in the child's well-being over time, who has high expectations for them and who is there for them. So this next part, again, we will be really kind of applying this more to what you're seeing in your day-to-day work and how you can use this to support your work. And this was an acronym that I came up with. Some people hate acronyms, other people find them useful. If you hate it, then just ignore it. If it's useful to you, then go with it. So I'm going to talk fairly quickly because we don't have a ton of time left. This gets back to thinking about exposure and experiencing domestic violence as a traumatic stressor and breaching a sense of safety and protection consistently. So the S in safety refers both to physical and emotional safety, and what I think is really key here to take away is that it's important that parents can help children to reestablish a sense of safety and security, but it may have to be reestablished over and over again in their lives. So if something scary happens and the mom has to go back to court, the parenting arrangement changes, etc., scary events happen, the child may be back to that sense of fear, anxiety, and feeling unsafe for obvious reasons, right? So here are some of the things. We're not going to go into great detail about this, but some of the ways in which we can support parents is helping them think about routines, prayers, rituals, telling young children what's going to happen next, what comes next in the day, you know, all of those kinds of things. And information about how trauma affects us. It's so normalizing for us to know that, and for a parent to know that their kid's clingy or having temper tantrums because they're hyper-aroused. And it's not because they're a bad kid, and they can get through this with their parents' support. We also know that because of the secrecy that surrounds so many families with domestic violence, that it's really, in many families, there are implicit rules about how we should relate and what things we should talk about. And so part of restoring safety is really creating some safe space to play or talk or express oneself about what's happened, what my feelings are, what my worries and concerns are. Okay, so the second letter in the SAS acronym is interrelated with safety, and it stands for attachment. And part of reestablishing that sense of safety comes from knowing that the non-abusive parent is available to the child to help them organize their feelings that may arise when they're frightened, and that the parent will take actions to protect their children, of course within the limits of their control or the situation. So this is a point that I think is well taken and so important, and really ties back in with the question. And I think this slide may speak to the question, the last question that I read that came from one of the participants. So the child, the parent, and their relationship may be altered. I'm speaking of the non-abusive parent, by experiencing domestic violence. And the parent's faith in their own capacity to protect their child or children may be affected by what's happened. And so it's a slow process of healing and recovery. And what we do know from some of the research that's really exciting is that when parents are able to help their children become more resilient and heal from the traumatic effects, that they feel better about themselves and more confident, and that really kind of radiates out into all kinds of other aspects of their life. Parents are able and feel more equipped then to continue looking for a job if they don't have employment, to feel differently about themselves. And so it's really a mutual process of change and recovery. So the third S stands for self-regulation, and I was saying before that this is one of those capacities that can get most disrupted by exposure to violence. And again, it's really helpful to learn about what our responses are about, normalizing that, and then there are a whole array of things, and we're going to go into details, and I know many of you are using these now in your work as advocates or as clinicians with families, but ways in which the non-abusive parent and children can really regain a sense of control and calm, and things that lead to better self-regulation. You know, self-regulation starts very early in life when a baby's waiting for the bottle to be warmed up, and the parent in those situations is really the co-regulator. It's coming, it'll be here soon, that kind of thing. And gradually the child begins to take on that capacity for herself or himself. And by the age of 5, we expect the children have some adaptive coping skills in that way, and that they can delay gratification or if they get upset. If they're experiencing trauma, they're not going to be able to do that at age 5, and we wouldn't expect that. But what we do see happen is that if, in fact, children have experienced prolonged exposure to traumatic abuse within their homes, that particular capacity is going to be dampened. And it's such a critical capacity. So the last one is looking at enhancing self-esteem and self-agency. So children's mastering developmental tasks at each age gives us a sense of ourselves as being competent and capable in the world. And so we do know that for some children, their development gets derailed by exposure to trauma. And for those kids, we have to think about, are we expecting this 13-year-old to fulfill whatever we think a 13-year-old should do, or are they really kind of arrested at an earlier age in their development where they don't have the capacity to regulate feelings? And so we have to adjust our expectations as we're working with them, right? Okay, so the next 3 slides you will have with you after the webinar is over, and we've got it ready for you to download. I think Rachel said in the next day or 2. So these are some of the ways in which parents can help their children build self-esteem and self-agency, and we can help support parents. I'll let you read those. So it's so important to be able to make meaning out of experiences that have been overwhelming, that have been fragmented, that we haven't had a narrative for, a way of talking about. And when we can make meaning out of them, we can move to a different place of feeling worthy of love and care and protection. And also knowing that what happened to me and who I am is not defined by what happened to me. That who I am and what I'm capable of is much, much greater than that. I like the work that Brooks has done around thinking about islands of competence. All children have either hidden or quite obvious talents, interests, areas that they enjoy and that we can help promote. And the other thing that we find with families is that because of all the trauma that they've experienced, it doesn't leave a lot of room in their lives when you're in survival mode to have fun. And so when there is physical and emotional safety, beginning to think about ways to promote closeness between parents and children and as a family. So what I like about this approach is that it's actually universal, but it's also really helpful for children that have experienced domestic violence and perhaps other trauma in their lives. And as we're drawing to a close, I wanted to put up this quote by Maya Angelou, whose life and work and life's work has been so important to so many of us. So here's what she says: "I'm not sure if resilience is ever achieved alone, but if we have someone who loves us enough to be on our side, then it's easier to grow resilience, to grow belief in self, to grow self-esteem. And it's self-esteem that allows a person to stand up." So here are a few closing thoughts. I see this as one of our most important roles, to be able to support parents to strengthen their attachment relationships with their children in the wake of trauma. And again, by supporting the safety and well-being of parents and their parenting capacities, we help support healing from the traumatic effects of abuse. And we foster children's and families' resilience, safety, and well-being in the future. And so finally, we grow in the context of our earliest relationships, and we can heal through safe, loving connections with others and within supportive communities. And now you will have these online resources. This is in memory, as I mentioned, of our colleague Patricia Van Horn. And now I'm going to turn it over to Erin, I believe, who is going to talk with us about filling out an evaluation that will give us helpful feedback. Erin or Jen, am I turning this over to you now?
Yep, thank you so much. This is Erin, everyone, and first I want to thank Susan for such an incredible webinar. Also a big thank you to Jen Curley and Caption Colorado for their support in making sure this webinar ran smoothly. And lastly, we want to thank you so much for choosing to spend your time with the Center this afternoon. Within the next 2 weeks, this recorded webinar will be available on our organization's website, and there you'll be able to access the recording, PowerPoint slides, and handouts from today's webinar. In addition to that, all participants will receive an email from me within the next week or so explaining how to access this information, links to the slides, in addition to a certificate of your attendance. At the end of the webinar, so in just a few moments, you'll be taken to a very brief evaluation. If you wouldn't mind, please taking a moment to let us know what was useful and what we could have done better. That would be really helpful for us, and your feedback is greatly appreciated. Thank you so much for your time, and have a great afternoon, everyone. Take care.
Thank you.